While postnatal or postpartum depression is widely discussed in the media, postnatal anxiety seems to get neglected. So in this video, I'm going to look at how common postnatal anxiety is, what causes it, when you need to get treatment, and how it can be treated. Welcome to the Anxiety Attic, where I make self-help videos for anxiety disorders. If you've recently had a baby, you may have noticed some changes in your emotions, behaviours, and the way that you think. Or maybe your partner or family have noticed a change. This is no surprise because bringing a new life into the world is a huge change and a huge responsibility. Your previous daily routine may have revolved around work, but now it revolves around changing, feeding, and looking after this wonderful little human. You may worry about how you will cope, whether you are doing everything right, breastfeeding challenges, or the effect of the new arrival on other children. Or you might worry about the baby's health. There are just so many things to worry about, and your brain seems to have suddenly become very good at finding more and more. Let me know in the comments below what you worry about. So why is this happening to you? Well, there are a couple of reasons. Firstly, any big change in life causes stress, and stress has an impact on the brain. Studies have shown stress causes a reduction in a hormone called serotonin, which is linked to anxiety. But to make things worse, there are big biological changes happening in your body when you've had a baby. When you are pregnant, a hormone called estrogen increases, and this in turn causes an increase in oxytocin. You may have heard of oxytocin described as the love hormone because it plays a part in the bonding between mother and baby, but it also plays a part in delivering the baby. Oxytocin levels surge during childbirth and also helps to create breast milk. But after the birth, estrogen and oxytocin levels gradually decrease, and some research suggests that this has an effect on serotonin and dopamine. Low serotonin has been linked to anxiety and low dopamine to depression. So it's no surprise that most women with postnatal depression also have postnatal anxiety. So feeling anxious in the months after giving birth is quite normal. I noticed that my wife became more anxious after having our 2 children. It wasn't the level of an anxiety disorder, but it was quite noticeable. But this biological increase in anxiety makes sense from an evolutionary point of view. Until quite recently, a lot of infants didn't survive, so a protective and anxious mother increases the chances of infants surviving. But when does postnatal anxiety become a problem, and how do you know if you should seek help? The Diagnostic Guide for Mental Health Professionals is the Diagnostic and Statistical Manual of Mental Health Disorders, and amazingly, it does not even mention postnatal anxiety, so it's pretty useless. Personally, I think that's very bad when studies have shown that 10 to 20% of women suffer from postnatal anxiety. But it may be because postnatal anxiety manifests itself in different ways for different people, and therefore the symptoms are likely to fit into one of the specific anxiety disorders already listed in DSM. So I'm going to give you a brief description of the common anxiety disorders that may develop as a result of postnatal anxiety, and if you recognise one of them, I will guide you to some of my videos that go into much more depth into that specific anxiety disorder. The first one is panic disorder. It's not uncommon for women to have 1 or 2 panic attacks after having a baby, but if they're becoming more and more frequent and you start to fear having a panic attack and are avoiding places and situations where you fear they may occur, you may be developing panic disorder. If this sounds like you, then you will find a lot more information in my 8-video series on panic disorder that I have linked above. If you find that you're worrying most of the time, but the subject of the worry is constantly changing, then you might be developing generalized anxiety disorder, or GAD for short. Click on this video which explains the symptoms of GAD, and take a look at my GAD playlist also. If you find that you have intrusive thoughts that you feel an urge to neutralize with some sort of action or ritual, then it may be OCD. OCD is not just about excessive cleaning or checking. Some OCD thoughts can be quite strange and out of character, such as harming your baby even though you would never do that. So if you're experiencing any of these, click on this link, which is the first of 3 videos in my OCD series. You may become socially anxious, fearing people are judging or criticising you. If so, have a look at my social anxiety playlist. It's quite possible that you've had some traits of these anxiety disorders before pregnancy, but not at disorder level, and the postnatal hormonal changes and stress have exacerbated them. Of course, if you already had an anxiety disorder, then it may get worse during the postnatal period. So, what are the treatment options if you have developed an anxiety disorder? I will give you the main ones first, but I will also tell you some little things that may help. The main treatments are medications or talking therapies. The most common medications are selective serotonin reuptake inhibitors, SSRIs for short, They're also referred to as antidepressants, though they're used for anxiety as well as depression. Of course, any medication has side effects, which you'll need to ask your doctor about. The most common talk-in therapy is cognitive behavioural therapy, which can be very effective for anxiety and has no side effects, so might be your first choice. Nearly all my videos are based on CBT, so they will give you a good idea of what it involves. So make sure you subscribe, and I would also appreciate it if you would like my videos, as it helps me reach others struggling with anxiety. Finally, some of the little things you can do to help. Talk to other mothers. You are not alone. They have likely been through something similar, and they're not going to judge you. Try to get as much sleep as you can. That might mean sleeping when baby sleeps. Avoid cigarettes and limit alcohol and caffeine, as these all make anxiety worse. Try to do some gentle exercise like going for a walk or swimming. Discuss how you feel with your family, and if you have a health visitor, definitely discuss it with them, as they will have seen thousands of women who feel the same. For most women, these feelings of anxiety will pass as the hormones stabilise and you adjust to your new life. But if your anxiety is not getting better, please try to get some help. Being a parent can be a wonderful experience. Don't let anxiety rob you of some of the best years of your life.